I think there's something in there. Yeah?
Mm-hmm. Ooh. Oh my. Holy crap. Did you feel that? It was like... Oh, I slipped and peed and I fell.
Part 3, Dan Dangler. We're going to start off with a little interview. We're going to read some of the comments from our prior videos. Would have been hilarious if her scenes were playing on the TV. Oh, those type of scenes. I was thinking they were talking about like the other YouTube videos.
What?
I don't
No!
Yeah,
They mean the dirty stuff.
Chiropractors can help your back the same way that a massage therapist can help your back, but they're no doctors.
I don't understand. Why do I feel better than after?
That's hilarious. Doc, looking out for the feet community.
I got them. I got you, boys.
Man, so that's like our biggest video so far. I don't know how like your biggest video, but like I think the one we did on Instagram got 20 million views, which is wild because like cracking toes is like not a chiropractic thing. That's like what your boyfriend does to you, you know, like pop, pop, pop. We're gonna do it again for the feet community.
Yeah, and my toes are really nice and clammy right now.
Don't the feet house more bones than any other part of the body? So why do so many chiropractors not consider foot adjustments?
That's wrong. It's the ear, isn't it?
I think there's only 3 bones in the ear.
Oh, really? It's somewhere in my brain back there. In like a file cabinet that I like pulled out, you know?
First time she didn't fake it.
True.
Yeah?
Yeah.
Those are genuine reactions?
Mm-hmm. A lot of time it is fake.
Men of culture, here we meet again.
What does that mean?
Do you know what it means?
It has something to do with like men liking like beautiful women.
Yeah.
Is this another skippity riz bullshit?
I think so.
They said she is really, really funny. Really, really, you got 2 of them.
Yeah. Probably should take a shower after touching her. Excuse me? Maybe after today because my toes are a little clammy. But not that time.
What is your intention to do your best Adam 16 impression in the thumbnail? Man, everybody always compares me to Adam 22, but I feel like we look nothing alike.
You guys look nothing alike.
We just like both have tattoos, I guess. Your name, where does it come from?
I stole it.
Yeah?
Mm-hmm.
Who was Dan Dangler before?
One of my friends had Dangler as their name, and I thought it went well with Dan. I was like, Dan Dangler. Are we getting a close view of my toes? Is that what we're trying to do here? Here, let me just take a picture. It'll last longer. Washed them, and then they're still like damp. They haven't like fully dried, like clammy.
All right, let's get to the chiropractic. So fun fact, we almost broke this table right before this video, so I'm curious to see if that's gonna hold up. You slipped on dog pee yesterday.
Nope, I slipped on it a couple weeks ago.
Okay.
And I fell downstairs, and then I fell into a pile of more dog pee. Because my dog was scared and was running, and she got spooked by something, so she was leaving a pile as she went. So I slipped on the top of the stairs, fell down the stairs, and fell into the bigger pile of pee. Hurt my back.
Why do you have so much pee in your house?
Well, she was like spooked by something. I can't remember what happened. It was like a loud noise or something, and she went running. And I went to go like walk after her or whatever, and I just...
So you've showered since then?
Yes.
Okay.
Cool. Maybe.
So what are we working on with that slip? Did you fall on your shoulder?
I fell on my back. I don't know. It just, now whenever I tense my left butt cheek, my back will crack.
Okay.
I don't know what that's about. But now I go to a place, I cheat on you with this place called the Joint Chiropractic. And, sorry, I have to get adjusted more than you're in town. But want to know something? The guy was really creepy, and before, like, when he wasn't adjusting me, he was like touching me like this, like that. Like he went like right there on me.
I feel uncomfortable.
Yeah, I'm sorry. I didn't ask for permission. I apologize. And then after I left, the next day he texted me and he was like, he goes, hey, how did you like your adjustment yesterday? This is Dr. blah, blah, blah. And I was like, that's weird because usually it comes from the front desk,
yeah,
you know,
like
if anything. And then he texted me again a couple hours later when I didn't respond. And he was like, how did my staff do yesterday? And I just, now I go to another joint.
Oh, man. That's part of our profession. No, I'm just kidding. Our profession's going in a good direction.
Yeah.
Shout out to all the people doing good things in our profession today. So left butt cheek, left lower back. That's kind of...
No, I don't know. It's like my sciatic like area.
Okay. Are you feeling the sciatic pain down the legs or more into the glutes?
It's like...
kind of sacrum area?
What is this?
Sacrum?
Yeah.
Okay, cool.
That, my upper back, my posture Bobas. Not good.
Well, let's just kind of run through a full run through. So I'm gonna have you go ahead and look all the way over your left shoulder. Any pain, pinching, or tightness with that?
No, it just stops like right there.
Okay. And if you look all the way over to the right shoulder, good. Do you feel like that's easier? You have full range of motion. It actually looks a little bit less on this side.
You think?
Do you notice that?
I sleep this way.
Okay, cool.
Like
We'll
on
get
my
both of those.
stomach this way.
What if you look all the way up towards the sky? Any pain, pinching in the back?
I mean, there is, but I don't know if it's abnormal.
Okay. And if you take your chin all the way down towards the chest. Why is that funny?
Yes.
Bring your right ear all the way over to the right shoulder. And then the left ear all the way to the left shoulder. Awesome. Can you go to the right one more time?
Yeah, that was harder, I feel like.
Okay, cool. Yeah, it seems like all your stuff's on this right side.
Which means what?
Closing ankle pain. So kind of what you asked, or what the comment said in the beginning. So they said massage is better than chiropractic. So it actually isn't in this case. So if you're looking over to the right, you're not getting as far. Usually that indicates the joint's a little bit more locked down. And so that adjustment will clear that out. When I push in on the right side versus the left side, is that a little bit more tender over here? Yeah. Cool. So let's actually get into that. I'm going to have you tuck your chin down as far as you can. Bring the chin over to the left shoulder and go ahead and pull your arm all the way across. If you can grab that elbow. And then go ahead and take 2 big breaths for me.
What's up, brother?
Can we put that clip in the back? Go ahead and come all the way back. Good. And then same thing, chin down, over to the left, and then all the way over the right shoulder. Yeah, so I forgot my needles today, so we're gonna just do kind of hands-on stuff today. So let's see. Usually that works pretty well. Let's go ahead and stand on up. I'm gonna get back into that spot in just a minute.
Okay.
So let's go ahead, stand right here, and then face me. And go ahead and twist all the way to your left side, bend backwards from there. Any pain, pinching, or tightness there?
No.
Okay, let's go all the way to the other side. Feels pretty good?
It feels like I gotta crack it.
Okay, go ahead and slowly run down, touch your toes or as far as you can. Good.
That's fine.
Can you slowly come on up?
This hurts.
Go back down a little bit. Tuck your chin down. So you can kind of see if you can come over here, almost get like dead on. So you see how her right side kind of kicks up. So we've got more hypertonicity on that right side, and you can definitely see that on there. Cool. You can go ahead and slowly roll on up.
My back hurts when I do that.
When you come up, does it hurt with coughing or sneezing?
No.
No. Okay. And you said that sciatic pain you just feel kind of into the glute area there. Okay. So go ahead and take a seat.
I can't. I'm moving right now, and it's hard to lift boxes.
Okay. So when you come up, that's where you're feeling it the most.
Even when I use my legs, it hurts.
So if you kick your left leg out straight, this is called slumps test. If we pull the toes back towards you, do you feel anything behind the knee?
Yeah, stretching.
Okay. So if you tuck your chin down, does that stretch get crazier?
I think so. Maybe a little bit.
So
Not
slouch
crazy.
in your lower back. So kick your lower back backwards. Yep.
Oh no, nothing.
No pain at all?
None. The stretch went away when I.
Okay, cool.
But when I go like this, it stretches.
Okay, go ahead and pull the right leg back and pull the toes towards you. Big tuck with your chin and slouch forward. That feels okay? Let's go onto your back real quick. I'm gonna do straight.
On my back?
Yeah. So this is called straight leg raise test. Feel good there? Okay. So we're gonna keep the knee straight and the toes bent backwards. Let me know when you feel that stretch behind the knee.
No.
Okay. If I point the toes, does that go away? Cool. So that is called Braggart's test. That stretch that you feel behind the knee is actually your sciatic nerve. It's not a hamstring stretch. So this is more hamstring stuff. Do you feel how that feels more muscular?
Wow.
So that is your sciatic nerve, and that's kind of what you were talking about before. So let's just kind of look at this side too. So let me know.
So does that indicate a problem?
It does. Usually in the lower back. So there's going to be likely like a little disc herniation. We're not looking at like DJD or arthritis or anything like that.
Yeah.
We're looking at more like disc herniation, soft tissue type stuff.
Cool.
Let's just check out this side. So let me know when you feel anything behind the knee. Cool. So this side's good.
Now, I finally.
Okay. But that is within normal range, and you feel how this is more of a hamstring stretch.
Mm-hmm.
So that's how it should feel. If you're ever stretching and you feel that stuff behind the knee like that, especially for what you have now, that's not something that we want to push through. That's your nerve that's stretching, and nerves don't like to be stretched. So I'm going to kind of retest that at the end, so we can kind of see the angle on the video. Is the lighting okay with that?
It's okay.
Just okay? We can change it.
Yeah, it's fine.
I don't like that answer. That's a horrible answer. That's so mean.
I'm like, we're in so deep now. It's like...
We're in so deep now.
Pause.
Yeah, but any clips.
Yeah, we're going to clip a bunch to make it interesting.
Oh, my armpits aren't shaped. That's nice. Can you tell on there?
So I'm going to talk about that sciatic nerve stuff because it's a really common problem that we have, and I think it all kind of starts in like gym class when we're in high school or middle school, elementary school, when your coaches are like, hey, straighten your knees and pull your toes back towards you. When you feel that stretch behind the knee, it's important to know that there's actually not any muscles behind the knee. Mm-hmm. There's the popliteal muscle, which isn't big enough to really be significant or feel a stretch. So if you ever feel any stretches behind the knee, that's not a good thing. That's your sciatic nerve. And it will usually indicate a problem either in the lower back or in your piriformis muscle, which is in your butt. Where you pointed to was more of like your sacrum, L5, S1, and that's a very common place where we get disc herniations. We can confirm that through an MRI, but we also don't really need an MRI to kind of start with treatment. So I kind of promote lumbar extension, so that's how I'll adjust you today. And that helps push the disc or kind of set the disc into a better position. So there's less stress on that nerve and we'll get less pulling through there. So I'm gonna do a bunch of soft tissue stuff there in a minute and then we'll kind of recheck that. Sorry. I'm also working on the right side. So we're just in the cervical erector muscles. You doing okay?
Do your worst. Oh.
How did you do with the needles in episode 1 and 2? I think episode 1 we
did. You gave me back. Like the highest or whatever. Yeah. For some reason, I do fine with like stuff like that. Like I had like an ab stimulator before, and I maxed out their machine, and I broke like their record by far. And I was like, what the fuck? Like it just so weird. But then like I cry during tattoo removal. Yeah. So I don't get it.
Tell me about your tattoo removal.
It's so bad.
What are you removing right now?
My side and my back tattoo.
Oh, I see that. Was it a mistake of a tattoo?
Yeah, they were when I was young.
How old?
Like 16. Don't get tattoos when you're young.
That's so funny.
I know everybody says that, but seriously, be careful.
That's what Rachel, my girlfriend, fiance, I guess.
Mm-hmm. Yeah.
We've decided not to use that word. It's like too pretentious, I feel like. Mm-hmm. But all of her tattoos were done in like a garage when she was 16. Are you going to get more tattoos or do you like...
I think I'm okay.
Yeah. I've obviously... You can probably see the progression of my tattoos in part 1, 2, and 3. A little bit of an addict.
Yeah, so, I mean, I'm for it, but like I don't really have anything I really want right now, so I'll wait.
Yeah. Let's get into extremities, and then we're going to get into the neck, the lower back, and all of that stuff. So I'm going to take the wrist right here. You ready? All right.
I'm done. I'm done.
It's the first crack of the day. I never start on the wrist.
That hurt.
You ready?
No.
You want me to skip them? We got like 2 more. They're going to be more fun.
Go.
Okay.
I have the weakest, wimpiest hands. When I was moving, I was like, fuck these hands. I was so mad. I couldn't carry anything.
We're just going to get the worst out of the way first. Jeez.
What do you mean, jeez? Is that loud?
No, that was really loud. I'm sorry. I know that hurt. It's good for you, though. All right. We'll get knees and ankles. All right. Crack. Cool. All right, the toes. I broke your thing again. She in?
Yeah.
Oh my god.
Rate my toes sweatiness.
We're about a 3 out of 10 on dampness level, moist level. We say 5 out of 10. Get in here really close. These are disgusting. Again. Oh my gosh. Jeez. We are. Oh man, the pinky toe, it's too slippery. Here, I'm gonna have to use this.
I shouldn't have washed them right before.
Okay, that's all it's got.
She doesn't have much of a knob, you know.
All right.
There's not much to crack there.
No ankle bracelet on this one. Okay, pulling this guy. Perfect. You're performing better than our 20 million view video.
Ooh.
Yeah, your pinkies are too slippery. I'd rate your pinkies a 10 out of 10 on the sloppy.
I apologize. I have anxiety, that's where it shows.
On the pinky toe.
No, my feet. My feet and my hands. They get really sweaty.
R.I.P. memorabilia.
This actually costs so much money. A whole 10 cents from
Alright.
China.
Go ahead and sit up facing this way. We're gonna get the neck. Cool. So right side, closing angle pain, scoot forward a little bit. This is where massage differs from chiropractic. Go ahead and look to the left side. Yep, good. A little bit less, perfect. And let the head fall there, good. Oh, so let the head come to the side. Go ahead and go into your back. Come on. All right, this is the problem area.
Ooh.
Sorry. You're welcome. And I'm gonna come a little bit lower into this spot here. There we go. Making me work today.
How out am I on crack level?
Your wrists were like 10 out of 10. Toes were 10 out of 10. I'd say your neck was like a 5 out of 10. Maybe better.
Wow, how lame. What a lame neck.
Look at them, shit.
Right.
Alright, go ahead. We're gonna cross these guys. Go ahead and tuck your chin down. Let all the air out.
Ooh, that felt good.
10 out of 10.
Yeah, that was great.
Lighting looks so good right here. We're just gonna use your house to shoot it. Alright. Same thing. Tuck your chin down. Let the air out. Good. Oh, sorry. That's tough. You down for the Y shot?
Yeah.
Go ahead and scoop all the way down towards your feet. Pull out your ankles, hang off the edge right here. What are we at on time?
3 hours and 20 minutes.
Sick.
Just kidding. 27
Let me
minutes.
secure the wig.
I'm gonna pull the wig off.
It's a wig? I never would have guessed.
I'm a short hair brunette with a little afro.
Okay, I can tell by your eyebrows.
Yeah, it's short little afro.
With a little afro, she said.
It's very 70s.
Alright, go ahead and point your toes down towards the floor. I got
Hang
some
my arms
signs.
up.
That could work, yeah. Did we get movement there?
I'm kidding.
Where did you feel that?
My neck.
Okay, they didn't go all the way down. Scoot down just a little bit further. I'll use my hands because this table's sliding too much. Alright, let the head kind of drop backwards. Good. And keep the teeth closed here. Good. If you could actually take your hands and clasp them, like around, like just kind of grab them like that. Yeah, good. Alright, let the head be really heavy.
Oh my. Holy crap. Did you feel that?
Yeah.
It was like.
Went all the way down.
Yeah.
Yay.
Ooh, that was good.
So doctor's out. That's how he does it. Yeah, the table's just sliding too much. Go ahead and face me on your side over here. You can put your head right here. Man, this table is definitely on its last leg. I'm a little bit nervous about this one.
Just get one on Amazon. Like I said, you'll be like a temporary one.
Alright, go ahead and look over your left shoulder there.
Oh, wait. My earring got stuck.
Good. Okay. Good. Let that left knee drop.
Ooh.
Perfect. That's so good. All right, I'm gonna slide this through. Good. Look over this shoulder here. All right. Already cracking.
That feels good.
Can you go ahead and lay onto your stomach, but looking over towards your right side?
Mm-hmm. That's how I sleep.
Perfect.
Like this.
Okay, maybe on this side. Let's check out the hips. Cool. So we see a little bit, so the right heel gets to the butt, the left heel not so much. I'm gonna kind of look at that side. And that was your side that you noticed a little bit more sciatica on, right?
Okay. I don't know yet.
Cool. So no needles today, but I'm gonna use my fingers of death. Are you doing okay with that?
Mm-hmm.
Okay.
My lower back is like a brick wall. But my upper back, I'm like a puss.
It moved pretty good though. I feel happy about it. So
Good.
I'm excited to do that pre and post check, see if that sciatica reduced a little bit. So a lot of times we don't notice that the nerve tension goes away right away. That's sometimes like a 2 to 3 hours later, next day.
Yeah.
I'm looking at more mobility, which I know felt pretty good. So we might not see like crazy before and afters. We'll kind of check out that right side of the neck, the left side of the low back, to see if it feels a little bit more freed up. But are you still moving tomorrow?
Yeah.
Just unpacking.
Mm-hmm. Fun stuff.
Well, this is a good little break in between.
Yes.
I won't be out here all week, so round 2s. Unless you're gonna cheat on me again. At a joint.
Well, I have all you guys now. I do all of it.
Alright, we're gonna get into the glute a little bit. So piriformis is the other muscle that goes over the sciatic nerve.
Ooh.
Do you feel that?
Why does that twitch?
It's just a little nerve.
Is it normal?
Are you feeling okay?
My butt cheek hurts. No, it hurts.
Come into the sciatic.
Why does it hurt so bad?
The minute you last, it doesn't need to be that bad. So here, I'm gonna do a
Is
little...
that normal to hurt that bad?
I mean, we're in a really tender spot. I went right over the sciatic nerve, so
Okay.
you can feel, so the greater trochanter, so for the audience, it's that little bony part right here. It's right here, so I can kind of feel that when we move her hip in and out. So if we go pretty lateral to it, that's going to be, so to see how my thumb moves, so right into that spot is her piriformis muscle, and that's the muscle that sits right over the sciatic nerve. So if she has piriformis syndrome, which it doesn't sound like it, that'll be a little bit more tender, or she'll notice that sciatica kind of popping up when she's sitting down. I like to go a little bit broader with the contact and use my elbow into that spot and take it out, and that way it's a little bit more comfortable for her.
Uh-oh.
I guess our camera died. Oh, is that the memory card? That's okay. We don't need it.
We got all the cracks and stuff though.
Yeah. Are you doing okay with the pressure?
Yeah.
Okay. So then I like to come up, so if we anatomy again.
Does this record still?
Oh yeah, we got this one, the main one.
Oh, okay.
It was just the B-roll.
Oh, that one. Okay. I was like, oh no.
So piriformis is here. If we come up a little bit, so almost like the top of the greater trochanter, we're gonna get glute minimus and medius here. And it does the same motion, so it does our external rotation. Yeah, some people feel ticklish, sometimes it's painful, sometimes it feels
It's
good.
tickly at first and then it's painful.
If you want to breathe, making your own jokes, she did say it. But yeah, breathing through that will kind of kick in our parasympathetic nervous system. So a lot of times if you go too crazy with the massage and to the point where it is painful, our body's not as accepting to allow those changes to happen. So breathing through the belly kicks in our parasympathetics, our rest and relax, allows our body to open up into changes a little bit more. Glute max is kind of where you described here earlier. That's almost more into the sacrum. That does our leg extension. I'm not really in a position where I can bring the leg up. So I'm gonna have you come onto your side facing this way.
This way?
Yeah. I normally don't do soft tissue like this in the videos, but let's see if I can bring your head this way. See if this angle might be a little bit better. Are you comfortable there?
Mm-hmm.
Okay. So we're gonna go into this area. So you're gonna start into leg extension here, and then you're gonna bring your knee up as high as you can right there. So you're gonna kind of work with me a little bit. So go ahead and pull that all the way up. Is that kind of where you're noticing it? Okay. If you want to see my hand placement on this side, so let's go ahead and kick this out. So we can do tension either upwards or downwards. So before we went down, go ahead and bring that knee up towards you. Good.
Ooh.
Is that kind of where you're describing
Ooh. I don't know what you're saying, but ooh.
Is that too much?
We have to do it.
Okay. Go ahead and come on back here. Good. And then go ahead and bring the knee up again.
It's so weird. It like tickles at first.
It's usually painful for me.
It tickles at first and then it's painful.
Go ahead, kick it back. Let's do one more.
Ooh.
And then I'm gonna have you go ahead and bring that knee up again. Last one, and let's get 2 big breaths in, and then we'll be done.
This one doesn't hurt as bad. 2 breaths.
Good. All right, go ahead and come on up. Actually, go on your stomach one more time.
Okay.
You're okay with CBD?
Mm-hmm.
All right.
No. Just THC.
Actually, let me, do you have like a towel or something that I can kind of slide this down to here? Or are you okay with this because a little bit of CBD on it?
Oh, just move this.
Okay, cool, yeah. That,
Are you
that's
gonna
normal.
get in
No,
trouble?
that's perfect right there, yeah. Cool.
Shows my love handles this ankle.
So I'm gonna just slide this right here. Perfect. Do a little CBD. Yeah, we actually took all the THC out of this one. This is
I can't smoke.
If you ate it, so we do have like a, I don't know if I could say this on YouTube, but we have the other version, and if you do eat it, you'll actually get the effect that you would get if you were smoking. We took all the THC out of this one so that we could sell it to like cops and CDL drivers and stuff like that. Is this ticklish?
No.
But you wouldn't want to eat this one. It would have the CBD effect, but we put peppermint in here, and so it probably wouldn't taste that great. You doing okay with the pressure?
Mm-hmm.
Okay.
It could be harder. You're good.
Cool. ASMR. What are we at on time?
37 minutes.
Damn. Okay, we're gonna have to cut. But I'm curious to see how you do with just the soft tissue, not the needles. So, cool. All right. Go ahead and sit on up. And actually, you can stand on up. And let's go through. Just twist to the right, bend backwards. See how that feels.
Oh, good.
Yeah. All the way to the left. And then you noticed
I
it.
feel rubbery.
Yeah. So you noticed it when you touched the toes and you kind of came up. And see how that feels.
Oh, so much better. I'm gonna be so sad in like a week when I need you again. I'll be so sad.
Go ahead and look over the right shoulder again. See if that feels like it's a little bit more opened up.
That feels good.
Cool. Awesome. Yay. Let's keep it at that.
Woo!
Cool. If you made it this far in the video, this is a super long one. Thank you for watching. Make sure to subscribe. We are posting, I guess we're down to 1 video a week, so stay tuned. Thank you. So cheesy.